Wisconsin is among a handful of states and places around the world seeing an unusual uptick in child hepatitis cases. This morning, we're joined by Dr. Emma Mohr, a pediatric infectious disease physician at UW Health Kids, to explain more about this. Good morning, Dr. Mohr.
Thanks for having me this morning.
Of course. So, with the basics first, do we know why this uptick in cases is happening, especially in kids?
We don't know exactly why this is happening in kids. We know that we're seeing a cluster of cases of kids developing hepatitis or inflammation in their liver, but we haven't found a common factor for all the kids that have been affected yet.
Could it be at all linked to COVID-19?
So we think it's probably linked to a virus, but we don't think it's just COVID-19 that's impacting these kids. We've looked for COVID-19 or SARS-CoV-2, the virus that causes that sort of infection, and we have not found that in all the kids that have hepatitis. We think there are other viruses at play, maybe an adenovirus.
Yeah, very interesting. But what are some symptoms that parents should watch out for?
So if your child presents with fever, abdominal pain, diarrhea, especially if they have light colored stools, and if they have yellowing of their skin, and if these persist for a couple days, even half a week, go to your regular doctor for your children and have them checked out.
And is there anything parents can do to prevent any of this from happening to their kids?
So the best way to prevent viral transmission are things like washing your hands, wearing a mask, covering your cough, and not being around sick people.
Yeah, all very important things that I think a lot of us sometimes forget. Dr. Mohr, thank you for joining us this morning.
You're welcome.